Hi, I'm Dr. Olga Kharevich, and today we are going to talk about teeth in a day, or All-in-4. I wanted to clarify the situation from the beginning that teeth in a day is a little bit different than the All-in-4 idea. The principles of placing the implant and loading the implants in the same day and giving the patients the fixed temporary prosthesis is the same. The major difference between these two concepts is that in teeth in a day there can be multiple amount of implants, 6, 7, 8, and in the concept with All-in-4, basically there are only 4 implants that are placed in the mandible or the maxilla in order to fixate the temporary prosthesis. And the difference is that with the current clinical conditions of the patient. Usually when the patient doesn't have severe bone loss and has enough of the gum tissue, we go with conventional concept with crown and bridge work, and 7 to 8 implants can be placed in order to give the patients the desirable effect. In the situation when the patient has severe bone loss, pneumatized sinuses, for example, the patient was edentulous for many years and they have severe resorption of mandible, which is usually a very limiting factor, we place long implants which are placed under the angle, so we kind of bypass the nerve and we are able to give in this situation the fixed teeth for the patient. Also, I want to say who is the candidate for this type of treatment. Usually these are the patients who have either broken and decayed teeth, have multiple missing teeth, and the patients who have had multiple endodontic treatment of their teeth and they have periapical lesions, or these are the patients who have been edentulous and were wearing removable prosthesis for quite some time. So these are basically 2 major categories of the patients that are eligible for this type of treatment. The limiting factor usually is severe smoking and decompensated diseases like, for example, diabetes. We see a lot of patients with diabetes and we try to bring them in better health with the help of their physician in order to prepare them for the surgery. And also the most common question is what type of prosthesis they will get and what they need to expect. And basically during the surgery, when the patient comes, and for example if he was edentulous, we prepare the right new removable prosthesis that later will be fixed, so the patient will have fixed teeth, shown like here on this picture. So basically this will be the small denture that will have the pink gum and it will be fixed to the implants. Or it can be another type of treatment, like for maxilla. So in this case, the implants will be supporting the temporary prosthesis, and this prosthesis is not going to have the palate. So the palate in this situation will be opened. And I wanted to emphasize your attention that this is still a temporary prosthesis. We usually recommend in 5 to 6 months to change this prosthesis into the final. And the final prosthesis can have either metal substructure with plastic teeth, or it can have metal substructure with porcelain, or zirconia substructure with porcelain. Of course, porcelain teeth look nicer and they look more natural. But again, this is the question that every patient decides for himself, because the difference in price is quite obvious. And usually it takes about 2 to 3 months to produce the final prosthesis. So basically in about 8 months you will have beautiful, absolutely gorgeous, natural smile. And we have multiple patients who mentioned that this type of treatment, Teeth in a Day and All-on-4 cases, it completely changed their life. And probably the best aspect of this treatment is that when the patient comes in for the surgery and they have their broken teeth, decayed teeth, old crowns, and they leave our office with new, beautiful white teeth, it completely changes their attitude, their smile, and their just view for life. And also what I wanted to say about the surgery, what to expect. The surgical part usually takes about 2 to 3, mostly 4 hours. The surgery is done under IV sedation, so basically the patient has the twilight sleep, but he is breathing by himself, and he basically sleeps through all the surgical procedure. And he wakes up with implants, and we need him to be awake to correct the occlusion. So in the end of the procedure, when we are attaching the prosthesis, the patient is awake. And we highly recommend this type of treatment for the patients who, for some reason, can't have conventional crown and bridge work with 7 or 8 implants with severe resorption of the bone and some limiting factors. So it's quite innovative treatment, and we expect good results with that. Thank you.